Welcome. The goal of May's Posture Month is communicating with the public and other professionals the health impact of posture, and also telling people what they can and should be doing to address their posture. And it's a really cool time to be talking about posture because suddenly posture is in all the media. Text neck is the price of staying connected, living in pain was one headline that we saw, and we coined the phrase Pokemon posture, and that got out into a bunch of the media things. Posture is a hot trend. We're going to talk about ways you can use that to really build yourself as owning posture in the minds of the people with whom you work and helping other people to be aware of posture, which in turn helps them to look at what you're doing as being important and relevant and you as being someone that can help them when they have a problem. So we're going to talk about some planning strategies for both internal and external. First, internally with patient engagement, building compliance for your current patients, and empowering them to understand what you do in a way that enables them to more effectively communicate to other people and to have them referred to you. And for that internal as well as some of the external tools on social media, especially, we're going to be giving you guys a toolkit in the next couple of days that we're literally putting the finishing touches on right now. And the toolkit has concepts and tools, both flyers and posters, and some cool ideas that we'll be talking about that tie into two big new opportunities for Posture Month 17. One is internal to what we're doing. One is what's happening in the world. Huge thing happening in the world of back pain. The American College of Physicians on Valentine's Day this year, that should be 2017, came out with new back pain guidelines. And this was covered in all the mainstream media, New York Times, Wall Street Journal, Washington Post, probably your local paper. And the American College of Physicians is the association for the internists, the PCPs, the medical doctors that are primary care in your community. If it's someone that sees patients for back pain in your area, 99.99% probability is they're a member of ACP. And they changed the recommendations for low back pain away from Tylenol and taking Advil, as well as NSAIDs and even opioids. And the new recommendations are no, drugs don't really work that well for back pain. Instead, you want to do things that are first making it feel better, things like a hot pack, and then spinal manipulation, not chiropractic, but spinal manipulation, which makes chiropractic in, along with massage, acupuncture, and some other things, including active care, such as Tai Chi yoga, and this is the words that they used, motor control exercises. And MCEs, and motor control exercises, is precisely what we teach. If you've seen me in seminars or online in webinars, the exercises that we teach from Strong Posture and the Strong Posture Protocols are motor control exercises. And this was a really cool report because when you read it, it basically talks about everybody that's got back pain, acute, subacute, or chronic low back pain. And they say that, yeah, people usually get better over time, but if it doesn't get better over time, you want to do more. And for either case, massage and spinal manipulation makes sense. But especially when pain's been going on for a while, you want to do things like motor control exercise, cognitive behavior therapy, which is a strong posture exercise or a form of, and multidisciplinary rehab, creating more mindfulness-based rehab and motion. And this is a really cool thing because this has never happened before, where there's been a acknowledgement of the people that usually prescribe medication that, for back pain, maybe medication isn't the best idea. Maybe a better thing is what chiropractors and other therapists have been doing forever. And the connection with posture is blazingly obvious because everybody knows posture causes back pain. Recent study found that 89% of primary care physicians consider biomechanical risk factors like posture to be the single most important short-term trigger for sudden onset low back pain. And that's one of the points that we talk about with with CPEP, with the ways to boost MD referrals. And this is one of the slides that we talk about. If you want to boost MD referrals, if you want the local PCP to be sending his back pain patients to you, because understand, he's just lost major, or she has just lost the major arrows from their quiver. Instead of telling people that they should be taking Advil, suddenly they have to look at that and know that that's not what's recommended. And the options they have, they don't know what to do with yet. So right now, this is a great time to be talking to them in their language, but that requires that you do it with building credibility and communicating in a biomechanic framework that is specific to the patient's problem, but also can be easily generalized to talk to the PCP or other clinician so that they can generalize it in a way to triage which patients they should or should not send to you. And this needs to also be congruent with your brand, how you're positioning yourself. And the point that we talk about is posture is the brand that you want both in the health professionals' minds as well as the public's mind. And this is going to be a huge thing because I was in the physician's lounge of a local hospital a week and a half after this came out. And this was for a totally different project that we're working with. And the physician's lounge had on it little plastic holders that you see here. This is a picture that we took. And in those plastic holders was the printout from Medscape about the new guidelines for treating low back pain. And I'm seeing some questions. If you guys want to ask questions, that's great. But if you would ask them, and I'm going to hold them to the end. So I'll handle as many as I can at the end. But you want to realize that in the minds of medical physicians that have been seeing probably still the majority of low back pain cases, they've just been told that the way that they usually deal with them needs to be changed. That's the number one big change. The number two big change, posturemonth.org promotes May as Posture Month, and this year there's going to be a directory listing to help people find a local posture professional, someone that looks at posture from a clinical point of view, regardless of their training, and that will take a free posture picture of that person. And the cool part about it is, from the patient's point of view, it's free. They're coming in, they're getting a free picture, there's no strings attached, and it's being communicated that way. From the provider's point of view, it's also free. We're not charging anything for you if you want to put it up, and you can use any technology that you want to do it. We suggest the PostureZone app. We'll show you how that works in a little bit. But if you don't have it, just use a camera. A grid's a good idea. If you don't have one, just take a picture against the door. The point is taking posture pictures, and we'll talk about why that's important in just a minute. Because overall, we want to build posture as being more socially relevant and to have you be the posture specialist. And let's talk about that for just a second, because a question that comes up is, well, how important is posture really? And some people tend to make a big deal when it's really not that big a deal. Um, Posture is an attribute of a body. How tall is normal? How many fingers are on each hand? If I've got 6 fingers, does that make it a pathology? Does that make me a variant? I don't. I've got 5 fingers. And also, a lot of the popular beliefs about posture haven't really been borne out in research. Someone having a high shoulder or high hip doesn't necessarily cause back pain, and the studies have not shown the correlation to be what you might think. A far more accurate observation is how the body masses deviate from this center line when you're standing and balancing. And also, things that are descriptive versus things that are actionable, describing things that people can do something about. Uh, One of the things that people talk about posture, this is from some people marketing and talking about posture, and the names are hidden to protect the guilty. Um, but one had a line on it talking about any deviation from the normal proper posture, and we disagree with that strongly. The perspective is your body is subtly unique compared to everybody else's, and your posture is therefore going to be a little bit different. It's far more. honest and actionable to benchmark each person's unique posture and then track their posture over time. This is a poster that I've seen in many doctors' offices talking about look at your posture, and that's great to create awareness, but putting a label on it implies that you're going to do something to fix it and make it different, which when you look at patients before and after, if unless you're having them doing a real postural rehab program, you they're not going to see that much difference. You want to connect them with what they can feel and then show them how they can see that. More on that a little bit. Um, where they talk a bit about correct posture being the position in which there's a minimum stress in every joint, and faulty posture is any position that increases stress. So what I hear when I read that is if someone doesn't have a perfect body, then they've got a problem. A functional framework of looking at posture, which is what we talk about with the PostureZone model, is looking at how four posture zones balance, align, and move. At where your head is over your torso, over your pelvis, over where you're standing, and how that's balancing and how symmetrically you're moving, and observing those four posture zones and looking at it from the back, from the front, from the side as where four masses are balancing: head, torso, pelvis, over where you're standing, from the front, from the side, from the back. And when you look at it from that framework, you quickly see that the connection between the top and the bottom, the second and third posture zones, torso and pelvis, is where there's a lot of control that has to happen. And then there's another name for that torso-pelvis connection. It's called the core. And regardless of which motion discipline you people come from, they just about always agree that motion begins with the core and stabilization begins with the core. And when you look at the core, the innermost muscles of the core are the diaphragm, pelvic floor, transverse abdominis or TRA, and multifidus. And generally accepted is if someone's got a weak core, the balance is going to be weak. So we're going to be talking about how to strengthen posture by retraining how those four posture zones are balancing, aligning, and moving. And doing it in a way to build awareness is what the game is. So the Posture Month initiative is building awareness of posture and encouraging people to observe how their posture truly is and communicating to them in a way that they in turn can communicate to others. We don't want to pathologize posture. We don't want to make the posture a condition that's an illness that can be cured or fixed. We do want to make them aware of how their posture is. And one point I want to make is the difference between posture awareness that, yes, I know posture is important intellectually, to a posture consciousness that I can feel the difference in my body's personal posture. And that's where we want to take people, to be more aware of their body. Because when you make people more aware of their body and more aware of their motion, if they're not moving well, they know it. And if you work on me as a clinician and you help me to move better, I can feel it on a more describable, perceptible, understandable way. And the key to take people from awareness to consciousness is teaching them something to do that's actionable, that they can make a difference with. And this is also key from a social point of view. I'm a doctor of chiropractic, and there's good perceptions in many quarters about chiropractic and some less good. The key to building social credibility and authenticity as a clinician and healer is whether the message is one that's self-serving or self-help. If everybody needs to come to me to get better no matter what, and they can't help themselves, there's a certain self-servingness to that. If I'm helping people to help themselves, and when there's a problem, the fact that I've helped them help themselves builds credibility because the message that I've been giving them is true and real and has helped them, but there's something else. That's building a real uh, a, a real credibility in the people's minds. A heart doctor doesn't say come in and have a heart surgery. They say do exercise, eat right, reduce fatty foods. If that doesn't work, they're there, but the goal is having a helping mentality rather than just a I can help you mentality. And so posturemonths.org, if you look at the website, the message is be aware of your posture. And there's some facts that we're going to be talking about, but we start out with also how people can get involved with a 31-day posture challenge, getting a free posture picture, and also a posture month giveaway. We're going to come back to that in just a second. But if you look at the facts side of posture, um, with the framework that we talk about is acing your posture, building posture awareness, control, and environment, and other things why posture matters. Take a look on your own. The message is be posture aware, take control, and optimize your environment. And there's a toolkit that we're going to be giving you guys that has flyers for your office. And the Posture Month 2017 flyer is one of the flyers that will be there. And the awareness, control, environment model is what we'll be talking about. The goal is making people aware of the body with a picture, teaching them how to control their body and build a strong posture environment. Beginning with creating posture awareness that they can communicate to other people. That's contagious, and that paves the way to building posture consciousness personally with them. And the only way you can do this is with ideas that are consistent and congruent internally, as well as what they know, and as well as what you're communicating to other professionals, because you want them sharing this message as well, so that you can help the people that they have that are suffering with things like low back pain. This is last year's toolkit. This year's toolkit is literally getting ready to go out this weekend. And it's about how to incorporate these tools into your practice on a week by week basis. There'll be an implementation roadmap, as well as some videos, as well as some other tools as well. Really big social media. There'll be multiple social media images going out every day. Some from last year that have been revised and improved, and some brand new images and concepts and campaigns as well. You want to connect with us online if you're on Facebook, Twitter, LinkedIn, whatever, and share our stuff. And also, you want to be sharing the message of Posture Month for your practice with your patients, and for your patients because it'll be good for them. And you'll see why in a second. The message is awareness, control, environment. Awareness starts with obvious things like people in front of computers all day long. 65 million people have back pain annually. Back pain related visits are the number 3 reason why people go to the doctor. 80% of Americans suffer from back pain during their life. It's the most common disability for people under 45. And posture affects how long you're going to live for. Everyone knows people lose height as they age, but many didn't know that your life can literally get shorter. As you get shorter, the more you shrink, the less longer you live because of the postural restriction of the lungs and abdominal organs, can potentially increasing the risk of heart disease, stroke, and respiratory mortality. And the point being, even if you exercise, if you're sitting all day, that's going to shape your body. And so it's not just how much you exercise, it's not just strong, it's how well you're standing, how strongly you're moving. And posture isn't a good or bad function, it's a strong or weak. And when you look at it from that perspective, there's always things you can do to make it better. This is the Posture Month Ace poster. This is also available this year as a full-size poster. There's a package. It's on Posture Month as well on PostureZone. That's on a discount till the end of the month. And it's a way you can share that image and that thought with your patients. If you want to print out flyers, which we highly suggest, for the first week 1, you want to put that flyer in all of your adjusting rooms. We're focusing on posture awareness, and part of that is having your annual posture check. It's posture picture. It's a must-do. You want to take a look at what your posture looks like, and teaching people that when you look at posture, it gives you a benchmark for how you're moving, and that's going to affect sports performance, how old you look, as well as how you age in terms of, among other things, improving your balance. And having people sharing this with other people, if there's a place that they can post this at work and put your card on it, or just leave the Posture Month logo on it and get listed as a place that you're doing free posture pictures. A picture's worth 1,000 words. It's way better to show somebody what's causing the pain than trying to explain it. So if you're listed in the posturemonth.org directory, they can find you locally. And there's a bit more to it because underneath this, there's some other things. 31-day challenge. We'll be sending out emails on a daily basis. We'll be sending out blog posts on a daily basis. If you'd like to share these, each day there'll be a new posture tip. Plus, people can enter to win a giveaway. Every day there's a prize that's going to be given away. And that's one of the ways that we're going to be working to engage people and that you can help us, help you, help pr- promote posture in the world. Because the more people, the more times people enter, the more likely that they're going to win one of the very cool Posture Month giveaways. We'll show you some at the end. And along with that, sharing images. This is one of the share images. The goal being to benchmark people's posture clinically, even if they're not a patient, just benchmark it so they know where the body is and educating them to interpret your posture as how you balance, and even empowering them, showing them how to take a posture picture that they can then share these ideas with others as well. One of the tools in the Posture Month toolkit this year is a new video on how to use the new version of the PostureZone app. More on that in a little bit, but you'll see some cool videos there as well. You want to, when you take a posture picture, a point I would like to emphasize, the instruction is stand tall. Show me standing tall. You want to engage them so that they know that they're standing tall. And so the differences between how the image looks and how they're feeling is a gauge of the error between their perception of where their body is and the reality of where your body is. Because functionally strengthening posture is not just about working on the neck or the low back. It's about the whole body. And the goal of changing posture is not changing it on a moment by moment basis so that it's different when you're looking at it, but to create a sustainable awareness and consciousness on the part of the individual that they start to move differently because that feels normal to them. You're retraining their perception of where their body is to be more accurate and doing it in a way to literally lengthen the spine. In other words, standing taller, sitting taller, moving taller. And so, in terms of incorporating this into an action plan for your practice, designate next the the first week of May as the awareness week, focusing on awareness. The next week focusing on control, the next week focusing on environment, and the last week focusing on ACE life habits. And there's posters and flyers for every week. So you want to keep on changing it out to keep the dialogue going internally and at the same time in your online social media world and whatever email contact you have with patients, sharing the same message as well. There's going to be daily shares, tweets, and posts. You want to share them. Week 2, you want to shift from awareness to, we'll be shifting from awareness to more about control, although all month we'll be mixing things up in a bunch of different ways. But in the office, make the conversation shift to control with a control flyer. And the message being posture is how you sit, stand, and move. And that core strength and great balance are needed for great posture. It's the difference between moving well and with confidence and the risk of injury from instability. And the part about control is having an action, something that they can do, a way that they can strengthen what they're doing in their daily life. It's more about trying to stand up straight. It's more than keeping your shoulders back. It's a personal posture consciousness. When you look at that, at this woman, she's sitting on a up and down kind of a desk, and she's sitting on a ball. So it's a really great posture environment from what she bought in her environment point of view. We'll talk about that in a moment. But when you look at her posture, it's not that great at all. A ball that doesn't roll around is just a cushion. Not evil, but it's not going to be reflexively training balance. And having the table at a height that she's flexed over is creating the same problem that she thinks she's solving. A different way to have the same kind of environment keeps the head over the torso, over the pelvis to align the body more intelligently. And sitting on a ball forces her to use core strength. And this is one of the messages that core control and strength are essential for good balance and strong posture in everything you do. Sitting, standing, moving. And one of the things you want to do when you take a posture picture is do it in a way that is promoting their awareness of their posture. If it's a patient that's coming in, working it into their clinical routine makes sense. If someone's coming in from the posturemonth.org website, you do not want to make it where they're coming in and they're about to be a new patient. You want to make it where they're coming in for their free posture picture and you're doing a public service to make them aware of their posture. And one thing to begin doing at that point is asking about if they have any problems and if what kind of area do they think they've got the most problem with the posture with, and giving them one of the posture month handouts as a takeaway of how to do something better. They say they're problem lifting at work, giving them the posture month flyer for bending and lifting. You don't have to, and you don't want to have every person that walks in becoming a patient because you, far more importantly, want to be building the community understanding, especially with other professionals, that posture is important. You're the person that focuses on posture in your community, and you do it in a way to help people stand taller, control how the body moves, to avoid back pain, and look better and feel better. And that's one reason why, if you're going to look at posture, you want to teach people something how to control their posture. And exercise is good, but all exercise isn't the same. Studies have shown that people with chronic back pain control their posture and they balance differently, even when they're having good days and they're not taking pain meds. And exercise can help, but far more, far, far better is exercising with focused attention on accurate posture control because that makes a big difference in improving function and as well as the ability to move with confidence if they've had a back pain problem, as well as protecting against the risk of a fall. A big meta study of motor control exercises found that in people with chronic and recurrent low back pain, motor control exercise was better than other treatments, including general exercise and spinal manipulation. That's because when we do motion control exercises, we're coming back to where motion begins, the core. That's where stabilization begins. The deep core muscles are connected biomechanically and neurologically. And so when you're looking at subtle differences in torso-pelvis relationship and the head and torso-pelvis over the feet, you're looking at asymmetries or errors in how someone thinks they're moving versus how they're really moving. And that's why, according to one study and what we talk about, training posture to move towards symmetry with control has a clinically important effect for chronic low back pain, especially when you exercise. And this is one reason why the American College of Physicians guidelines for low back pain talked about control things like yoga, tai chi, and motor control exercises, and why we were jumping up and down when we saw this, because that's precisely what CPEPs and others that use the strong posture protocols that we teach work with in their practices, and they individualize it for the person. Um, the idea of strong posture exercises is correcting sensory motor error with protocols to cue attentional focus and to create an ongoing feedback loop between the perception of where the body is and the reality of how it's moving in terms of its balance, its alignment, and motion, and communicating that to the person. So if somebody you just want to give a mini class in the office, or you want to give them a short one-on-one, one of the flyers from the toolkit is a beginning posture exercise BAM, where you're focusing somebody on each one of the tracks of posture, balance, alignment, and motion, and this is the beginning of the strong posture tracks. And there's a lot more information on this in different things that we've done before. If you do the strong posture work, this is familiar to you. If not, look at the websites. And you'll find that the images that we talk about, the share images, include the strong posture work along with yoga, tai chi, and other things that people are more aware of and that currently have more popularity as a way to control motion. Which brings us to the third week of Posture Month, when we're focusing on creating a good posture environment. uh, sitting, standing, sleeping, working. You want people to be looking at their posture environment, and you want to teach them how to optimize it for their body and give them quick fixes. Not just you have to buy this, but here's an idea on what you can do to improve your posture. You have a problem when you're sleeping? Try putting a pillow between your knees. That adds pelvic support. At work, set up your workstation intelligently. And if that's where the conversation goes, give them this handout for how to set up their workstation, and advise that they post it at work. And they tell people that they can get a free posture picture for the month of May. Go to posturemonth.org, and that way they can find you, or have or put something on the poster with your name on the bottom for them to put out as well in their office, not online, in their office. And you'll find that people start to become more posture aware and say, what can I do? And it may be, hey, I'm going to get a ball. Great idea. I've got one in my office right now. I'm not sitting on it. It's in the corner. I use a stand-up desk most of the time. That's what I'm doing right now. If you have this in the office, one way that you can build connection with patients, for those of you that are involved in the Upright Ergo resale program, giving them the flyer from this, and if they buy from the flyer, they can save $30, and you make money as well. And that's one of the many ways that you can incorporate an ACE model into a profitable way to build your brand in your community. All posture is about how you're balancing head over torso over pelvis over the base of support. If you're sitting, standing, and working, your posture is how your body's using deep and superficial muscles to maintain that. Retraining motor patterns to be towards symmetry with control is the idea of all all the strong posture efforts. And that's why the environment is so important. Because if you're loading something asymmetrically, it's going to create a problem. You spend a third of your life sleeping. Your mattress makes a big difference on how you sleep. By the way, we talked about giveaways for Posture Month. We're giving away mattresses. We're giving away a stand-up desk. We're giving away a lot of tools. And this is a way that you can engage your people in talking about posture in their community. And you are the person that is the posture specialist. Posture Month, uh, it's not just having a pillow to sleep on. There's other kinds of tools to improve cervical support. One thing I like is a Cervipedic. It's got a little air bladder that people can customize it. The image that they have is it holds your head like a baseball glove. The goal is creating an ongoing presence in your mind and in the people with whom you deal with minds that you're about posture. And May is Posture Month. Week 4, we want to tie it all together, building awareness, control, environment for ACE life habits. So I invite you to join us and talk about posture in your world. It's time for your 2016-2017 posture analysis. This is one of the share images, and we're looking to connect with other people in your community. So if there's someone in a local gym, talk to them. Offer to take posture pictures there as well. We'll be doing things directly with the media as well. We are working to build a larger presence in the world that posture is important. Michael Milliken put it well. Giving yourself to others is the most important thing. When you give, you get something back in return. This, we've created opportunities for you to communicate with the Posture Month resources and roadmap and toolkit. Setting up in your office a framework that, okay, there's a person that's designated, you're the Posture Month person, giving them the toolkit, letting them work with it, giving them free reign to take things up and put them down during the month. And in staff meeting, have a little review of that week's new tools. Have somebody put up a listing on posturemonth.org if you will take free posture pictures for the month of May. We will gladly give you a free listing. You can use any tech. A regular camera works. Uh, Posture pictures build the value perception of what you're doing, because very often people will see some change, especially when you make them more aware of and more conscious of their body's function and how they're moving. The PostureZone app that we talk about looks at posture from a functional basis, looking at symmetry of where the head, torso, and pelvis is, and measures the degrees of deviation of the head over the feet, the left and right side of the torso symmetry over the feet, and the pelvis over the feet from the front, and the general stack from the side. The free version is a free version. It doesn't cost anything, so you can show patients how to use it as well and encourage them to do it. Right now, it's iPhone and iPad. Android's under development now. It'll be ready summer 2017. If you are a CPEP and you are an Android person and you want to be part of the beta group for that, drop me an email, please. The Pro version is less than $30, one-time purchase that lets you manage cases and generate reports, which include the PostureZone deviations, and you can basically email those or put them in Dropbox, Google Drive, and move them in or out the way that you want to. Both versions of the updated version of the app have posture lines for assessing ergo and sports forms in a bunch of different ways. Um, if you, again, go to PostureZone on the app store, download the free version, play with it. Um, the the in the in-app upgrade lets you do the reports and case management and some other cool things also. The goal of Posture Month is getting people to be posture aware, teach people how to take posture control, and teach them how to optimize their posture environment. And it's about building relationships with your practice, with people that are currently engaged with you for retention, as well as people that you have taken care of before to recall them. John, it's time for annual posture picture is a postcard that some people have sent to reactivate a relationship with a person. We suggest people have at least an annual posture picture that you can compare this year's with last year's. If you're doing any kinds of weight loss or fitness programs or strong posture programs, you want to take pictures quarterly to benchmark and track changes over time. The big goal from your perspective is building your share of their mind space and about posture. You want to own posture in their mind because when they think about posture, you want them thinking about you. And that's one of the things that we do in terms of strengthening posture control with exercises that are integrated with communication ideas, which is what the Strong Posture Protocols taught by CPEPs and that we outline in Stand Tall, Live Longer talks about. In addition to relieving pain and rehabbing somebody, creating an awareness of why strong posture helps you to move, feel, and be well. And the exercises are set up along those same BAM tracks of balance, alignment, motion. And the alignment of each affects how your body balances because your body balances from the bottom to the top. The balance track challenges balance, keeps on making it harder, individualizing to the person to focus their attention on just one posture zone alignment at a time. As I said earlier, the strength of your balance is how well you know and can control where your body is in space. And you're correlating that perception to the reality of where your body is. Alignment track is the second track, the A, and that's where you're aligning those posture zones to something that's objectively vertical. Use a wall. Again, correlating your somatic perception of where your head, torso, and pelvis is to where the wall truly says it is. Motion track, we use balls. This is from a class that we did recently, and it's funny how when you get people up on a ball and moving, they're having fun. They enjoy it. They laugh. That's the energy that you want in your practice. And it's funny when people start to move their bodies in ways that they didn't know they can move it with control, they get excited and they enjoy the feeling of movement and they're grateful to you because you helped them to move differently. So what we're looking to help you do is to promote posture awareness in your world, including annual posture pictures, people that you've seen before, with people that this is the first picture, and the next year they're coming back and they're taking the posture picture, and you have the chance to compare last year with this year, and empowering them to control how they're moving the body. Could be as simple as giving them a flyer and suggesting that they start doing strong posture exercises, or take a yoga class, doing some kind of motion control exercise, and then doing things to optimize the postural environment from the chair to the desk to the pillow to the mattress. And sharing the message that posture is important to health, how you look. People look better with standing tall rather than slumped folded over. From a management point of view, their attitude's better, their productivity at work is better, and their happiness is better. So the toolkit is releasing this weekend. It'll be there before Monday morning. If you're on social media, start to follow the hashtag Posture Month. Again, sign up on Posture Month for a free listing. And we talked about the 31 days to stronger posture and the Enter to Win ACE giveaway. The posture challenge is basically giving people one thing to do every day, and the goal being taking them through 31 steps of doing different changes to life habits to strengthen their posture. And when we put these emails out, you want to share them with the people that you know, because that's making you the expert to them, and that's you helping them to do something on their own to strengthen their posture. And along with that there'll be numerous other share images coming out every day. Share with the ones that speak to you, but most importantly, share the big 31 days to strong posture one every day. There's also going to be the ACE giveaway. There'll be a different prize given out every day. There'll be things like stand-up desks that go up and down from Upright Ergo. There'll be some tough-to-needle mattresses. Uh, from a wearable point of view, there'll be Lumo Lift given away, Royal Wrist Memory Foam Pillow. Big on moving with strong posture, especially with walking poles. If you've never tried walking poles, it doesn't make it easier. It makes it harder if you're doing with strong posture form. A Cervipedic. We're big on balls, TheraBand balls, bunch of other giveaways, one every day. I work nationally, internationally, promoting the importance of posture. We talk in the media. I want you to start talking in your world about posture and adding our voices together to build a stronger movement that posture is important, and to be a leader in that movement. We invite you to join us and start planning today how you're going to participate and communicate in your practice internally, externally in your community, and especially virtually in social media and online, as well as personally, what you're going to do personally to start standing taller. Um, the messaging in the office, if you don't have a place to take a posture picture, set one up. It can be as simple as a door. If you have no tech, just use a camera. But again, we suggest PostureZone grids. If you want to get posters, you can order them. They're shipping out bunches every day. And if you want to download the PostureZone app, you get the weekend to start playing with it if you haven't played with it yet. It's easy to do. And there's training videos that you'll be getting as well. Externally, start to try to set up talks and meetings, especially with local groups. Many times they have email lists that they talk to the people with. There probably isn't time to get you set up for next month, but if you can get them to talk to their members about it, they can use that to promote you coming back to speak to them later on in the year as the local posture specialist. If you want everything, the grids and the lectures are discounted 20% through the end of the week for the setup for Posture Month. So if you think about buying anything, this is the time to do it. Virtually start building your online presence and start sharing the Posture Month shares. Connect with us on social media and start doing some strong posture exercises yourself. For grids and tools, go to PostureZone. If you want to learn more about the CPEP Posture Specialist program, which is the posture specialist program that is meaningful in the world, it's continuing education that's recognized by all the states, and the Posture Month program is being supported and partnered with by numerous state associations and different professions. Probably, definitely the significant majority of the chiropractic profession state associations, as well as others, are supporting it. You want to be part of a movement, and especially with the work that we do in the media and the tools with the Strong Posture Protocols. Check out Posture Practice for more information. Connect with me on social media personally, as well as the Posture Month organization, and go to Posture Month and set up and get your free listing. It's a free listing, and you get a free toolkit. We're going to take some questions in just a second. I'd like to thank our friends and partners, including Foundation for Chiropractic Progress, a lot of the chiropractic colleges, a lot of the physician associations, and if your association has not been sending you information about Posture Month, um, send them an email and say, hey, you need to connect with Posture Month and get your colleagues talking about posture, because the more we can ace posture in the world, the more we can make people stand taller, and the more you can help them to stand taller, which is a niche that will become increasingly important as boomers age and as everybody spends more time in front of screens and texting and living folded over. So I invite you to join the posture movement, and I'm going to take a couple of questions. We've got a bunch of questions over here. Uh, oh, how cool! How cool is this? Uh, okay, if you have any questions, now's the time to ask, and we're going to do some fast questions really quick. One question, Deb Burns, we're doing a posture party May 20th. I love it. We'll use the posters and go online, but the awareness piece with the in-office photos will happen on the 20th versus May 1st. This is this is set up as a community, as a global community effort. This is not meant where you have to do something on this day. We're putting tools out there and we're mixing it up, but one of the efforts is getting different people to coordinate. I'm a chiropractor and I've taken care of thousands of patients, but that's a drop in the bucket, especially since I'm not seeing all those patients on an ongoing basis. And some people went from me to somebody down the street, and somebody down the street, their patients came to me, and that's what happens in the world. Think what happens when that patient is seeing the same message coming from different people saying the same thing. It builds the credibility of that message. And this is why the more we can get voices of credibility and authenticity sharing a message that posture is important, which by the way, it really, really is, and teach people how to help themselves with it, the more the people that are sharing those messages become important. I love stories like that. That is that is great. Do me a favor, Deb. Let me know what happens with that, and if there's anything we can do with you, let us know. Also, just an idea for that. If you have doing a posture party, consider getting posture mints and giving those out. They've got the little posture message on it, and it's a nice, memorable takeaway. Again, you're trying to build mind space. Question about the app. John, you bought the PostureZone app Pro version for the old version of the app. Great. All you have to do is go to the App Store. It'll say update because you've already purchased it. If you update the app in the App Store, it'll download the new version. We don't charge people on a per picture basis. We don't charge them for updates. The new reports, you bought the first version of the app, you're getting that for free. That's the way that we've always done things. Our goal is helping people to help other people, and the people that help us, we want to keep on helping. Um, we're doing it in a way that feels right from what we think people should be behaving. I've done that in practice. We do that with the CPEP certification, and the people. If you have any questions about CPEP, talk to any of the people in it, and they'll tell you the strength of communicating posture. In fact, if you go on the website, look at some of the videos of different people that are CPEPs and see what they have to say about how well, when you really dial into postural communications and strengthening posture, it makes a tremendous difference with how people look at you and the world.